Hello and welcome to At the Forefront Live. COVID-19 is having a huge impact and will continue to do so. People are experiencing COVID burnout, and with the holidays upon us, we're all presented with a big challenge. Family gatherings are often responsible for the spreading of the virus, sometimes with fatal consequences. We're also entering flu season, and unfortunately, many COVID-19, flu, and allergy symptoms are similar. This makes the illness hard to diagnose. Infectious disease experts Dr. Emily Landon and Dr. Allison Bartlett join us to offer recommendations to ensure your pandemic holidays are as safe as possible. And as always, we'll take your questions during our program. That's coming up right now on At the Forefront Live. And we want to remind our viewers that today's program is not designed to take the place of a visit with your physician. Let's start off by having each of you introduce yourselves. Tell us a little bit about what you do here at UChicago Medicine. And Dr. Landon, you're to my immediate, left. So let's start with you.
Hi, I'm Dr. Emily Landon. I'm an infectious diseases specialist, adult infectious diseases specialist, and the hospital epidemiologist here at the University of Chicago.
And Dr. Bartlett.
Hi, I'm Dr. Allison Bartlett. I am a pediatric infectious diseases specialist here at the University of Chicago Medicine, Comer Children's Hospital, and I work alongside Dr. Landon as the Associate Medical Director of Infection Control.
So we have all of our bases covered from the very young to the folks that are a little bit older. So we're going to start off, and I do want to remind people we will take questions from viewers as we progress through the show, but I've got a couple of basic ones for you. And Dr. Landon, if we can start with you on this first one, and that's, how do people know if they have COVID-19 or the flu or allergies? We kind of alluded to that a little bit in the open of the show, and it's confusing to people.
Yeah, some of my friends put together a great graphic, but I think the takeaway point from that graphic is that you really can't tell the difference. So oftentimes when you'll have a fever alongside the COVID-19 and influenza, but sometimes that doesn't come right at the beginning. And so you really have to take any of these symptoms, these respiratory virus cold season symptoms, and assume that they could be flu, they could be COVID-19, or they could be allergies, but you can't assume that they're your allergies. The one thing that stands out, though, is that if you lose your loss of taste or smell, that one's pretty specific for COVID-19. And for any of these, you should probably get tested at least for COVID-19. And as soon as we see more flu activity, then you should get tested for that, too.
So, Dr. Bartlett, what are some of the latest travel restrictions that we're seeing in the Chicagoland area?
So in the Chicagoland area, we've recently they've changed our specifics on where you can travel out of state and what you need to do when you return from travel. The biggest picture change was that we have focused mostly on travel to states with higher rates of COVID prevalence than ours. And unfortunately, that is not a whole lot of states. We are in just as bad shape as many other places. And so the travel restrictions are for states that are higher prevalence than us, and the expectation is that after you travel, you come back and you quarantine for a 2-week period. But really, as I'm sure we'll talk about in a bit, it's more about what you do and less about where you do it.
Absolutely, and we are taking questions from viewers, and I want to get to those as quickly as possible and as many as we can during the program. Our first one is from Marie, and she asks, 2 people are talking 6 feet apart and both are wearing masks. One has COVID but isn't showing symptoms. A few days later, the person is tested and results are positive. What is the probability the other person will catch COVID? That sounds like that's a little complex, but
It's like a math problem that you don't really want to be in.
That's like a story problem right there, yeah.
I think the risk is actually pretty low for the person who doesn't have COVID if both individuals were wearing a mask, especially because they were 6 feet apart. Now, if those 2 people were outside, the risk would be even lower. If they're inside and that person with COVID had their mask off for an extended period of time before the other person walked in, that would increase the risk. So the actual probability is a little bit unknown and depends on a lot of different factors, such as ventilation, the type of mask, and all those sorts of things. And I know that the contact tracers in the community say don't even think about whether or not people have masks on. If you were within 6 feet for 15 minutes or more, you should take quarantine. And that is that's an out of abundance of caution kind of recommendation. In the hospital, if this had happened between 2 healthcare providers and that one healthcare provider with COVID later turned up sick for COVID, we wouldn't worry about anyone.
So this might be a pretty good segue to the risk factor websites that we talked a little bit about before the program, and I don't know, either one of you can chat about those a moment, and we have some video to run too, so we can show you what those websites what they look like and how to get to them. I don't know who wants to talk about these, but they're interesting sites.
I'll let you go, Dr. Landon.
Oh, sure. There's a couple of great sites. So first off, we have the My COVID Risk app that was created by some emergency room physicians at Brown University, and it takes into account all of the epidemiology in your specific location. You'll see in the next screen that you get to put in your actual zip code, and they look at the number of cases around you, and then you can sort of describe the different activities that you might want to do, whether they're indoors or outdoors, if people are going to wear masks, how many people are going to be there, what the situation is, and it'll tell you what your risk is. But the best part about this app is that after it shows you kind of what the risk is, then it tells you ways, you can click a button and look at ways for actually reducing your risk, which we're going to see in just a second here. Now, right now, if you did this in Chicago for any sort of indoor activity, you're going to get high risk for everything, because everything indoors with people that you don't know is high risk. But you can see here that when you do stuff outdoors, it's much lower risk. And you can see that little button there in the bottom that says lower my risk. Now, if I came up with an activity that was very low risk, I probably would not be clicking the lower my risk button. But that is something that you could do to help you understand how to make even a risky activity a little safer. Then there's also a really cool app that was created. It's a web app again. You don't have to download anything or pay for anything for either of these, from Georgia Tech, where they are looking at the number of cases in a community, and they give you an idea based on your location. On average, you can put in the size of the event you're going to have. So I think they're going to slide it down to something like 10 or 15 people and look at what the likelihood is of one of the people in that group having COVID. And if in Cook County, Illinois, you can see that at the time they took this video, that it was 35% likely that one of the people in a group of 10 would have COVID. Now, of course, this is an averages game. It doesn't really tell us, if you've got 10 people together who were quarantining ahead of, say, a Thanksgiving dinner and had no unmasked contacts aside from family members, then that risk is going to be a lot lower than if you had people who were just out and about and hanging out with people, having dinner with them, especially dinners indoors where you have to take off your mask, that sort of thing. So I think this can give you a good idea of the basic averages if you're going to go to a different place.
It's really neat to look at those examples, and we don't often talk about the people that kind of help us on the program too. John put that together for us. He did the screen capture. Thanks, John. That was great. Carmine did the graphic that we saw earlier, and a really cool video that goes with that graphic as well. Had some other folks help out on that. There's a whole team behind all of this, and they do the real work and all of this stuff, and I appreciate it a lot. Another question. What's that?
So do we.
Absolutely. It makes explaining the science a lot easier.
Heather and Ashley work with you guys. I mean, it's a whole big group, so it's really nice. So here's a question from Katie. What is the level of what level of safety does a negative test followed by quarantine confer? How confident can we be that the individual is truly negative?
So again, as with everything in COVID, this depends on a lot of factors, and I think the premise of this question is a negative test followed by quarantine is not particularly helpful. Because the negative test only tells you you're negative at the moment that you had the test. And so you could have been exposed the day before the test and developed symptoms while you're quarantining, right? Quarantining for a period of time and then getting a test is potentially more helpful. But really, the most important thing is to make sure that you are limiting your contact with other people and wearing your mask and staying socially distant as much as possible prior to gathering.
I have another question, and this one is from Ben, who is actually also a person who helps out on the program, but it's a great question. His question is, I'm making Thanksgiving dishes and dropping off some of these at friends' homes. What type of precautions should I take while cooking? And I guess the other part of that question, what kind of precautions should be taken while making the delivery?
Well, I'll just say that first of all, COVID dies in the heat. So if you're making hot dishes, you should be pretty good. If you're making cold dishes for other people, you probably want to wear a mask and follow the general food safety and food preparation guides that we would use, that anybody in any sort of food preparation would follow. And there's instructions on IDPH and CDC websites about how to prepare food for others. And so I would follow those. Then when it comes time to dropping them off, put them in containers, take them over, make sure you're wearing a mask, make sure they're wearing a mask, hand them off, limit your contact, and then get out of there. That's sort of the safest thing you could do. My mom was really upset that we wouldn't be having Thanksgiving with her this year. And so she called and said she was going to prepare a huge Thanksgiving dinner for all her friends. And I said, oh my God, Mom, that's a terrible idea. And she said, no, Emily, I'm going to invite them all to come over with their Tupperware, wearing their masks, and they can come in and I'll serve them up a meal in their Tupperware and they can take it home and eat it. We'll all wear masks and they'll just come for a couple minutes in and out, and I'll give them each their own time. And I said, well, that's actually pretty nice.
That's a great idea. I heard somebody else say that they're going to do a Zoom Thanksgiving where they'll do their thing at their home and then they're going to Zoom their family members and have them do their thing at their other locations, which is probably a good idea as well too. So Judy has a question for us, a viewer. Is the COVID and flu test, or are those two tests similar, I guess is the question.
So not only are they potentially similar, they are mostly now offered together with one swab. So a lot of the companies that are making tests are companies that have previously made tests for flu and for other respiratory viral pathogens, and many of them are combination panels. And so now there's wide availability of testing for COVID and flu, or COVID and flu and other respiratory viruses as well.
So can we talk about masks just for a moment as we enter this holiday season and for the foreseeable future? Because Dr. Landon, I know you've received a lot of comments about masks, and one of the comments that we've seen repeatedly is, well, we've got a mask mandate, yet the numbers are going up. Masks don't work. Well, I'd love to hear your take on that.
Yeah, that's not the case.
Yep.
People in Chicago especially are wearing masks in public places because they're required to do so. And we do see very good compliance in Chicago. There are, of course, a lot of other places where people are not being as compliant with wearing masks even in public places. But what the real problem here is that people are having visitors inside their homes, or they're going to indoor locations, maybe in an office, maybe in a break room, in a work room, or in their own home or their friend's home, and they're gathering and they're saying, we'll be 6 feet apart, so it'll be fine. And 6 feet apart is fine when you're outside, but when you're inside, you need to still have a mask. So people are taking off those masks at the wrong times. We know this because that's what people tell us when they come down with COVID. We talk to them and they say, oh, I didn't think it was a problem. I was 6 feet apart. And the reality is that our ventilation systems indoor are not the same as the air of the outdoors. They just can't keep the COVID apart. And so even if you're more than 6 feet apart, all those respiratory droplets will fill the room with COVID, and it doesn't matter how far apart you are. So if you're going to have your mask off indoors with other people, it needs to be for as short a time period as possible, because nobody knows whether or not they have COVID. And right now, more people are more likely to have COVID than ever. So I think it's really easy to take one look at a graph and say, oh, I know what's going on here. But it's often a lot more complicated than that.
So Dr. Bartlett, Carol asks, are the risks higher now than in the spring to grocery shop in person? And what kind of things, safety measures, would you suggest to people as they shop?
So I think echoing exactly what Dr. Landon just said, since the prevalence of COVID infections, the number of people out and about around us with COVID infections is higher now than it was back in the spring and summer. Yes, the risk of going to the grocery store is higher than it was. The risk of doing any indoor or outdoor activity is higher than it was. And so I think the important question that our viewer is asking is, what can we do to be protecting ourselves? And I am sad to say there's nothing new and exciting and technologically fancy that has developed in this regard in the past few months. It is the same advice as always. Try to find a time to go to the grocery store when there's likely to be fewer people there. Wear your mask. If you see others in the store that don't have their masks on or aren't wearing it correctly, give them a wide berth and step around them. Practice good hand hygiene. The thing that we've learned is that actually eye protection, even just eyeglasses, offer a little bit of of added protection. In the healthcare world, we're using goggles or face shields as an extra layer of protection. And if you are a high-risk individual and there's no alternative to you being the one to go to the grocery store, I think both a mask and eye protection and then frequent hand hygiene is the best way to keep yourself safe.
So Kim asks, I lost my taste 4 weeks ago and was confirmed positive 3 weeks ago. Still don't have my full taste back. Is there anything I can do to get it back sooner?
Patience, my friend. That's all we have for this. It does take a long time for people to get over COVID. A lot of people don't have too many symptoms and are feeling better quickly, but if you do have a symptom, they tend to linger. People who get even just moderately sick tend to have night sweats or to feel ill and be maybe not even fevers, but just feel ill and exhausted for weeks. The average time it takes for people to get their smell and taste back seems to look like it's about 6 weeks, but some people go considerably longer than that. The good news is that the vast majority of people do recover their taste and their smell. It just takes a really long time.
Now, I have two questions that are kind of similar, so maybe you can address both of them at the same time. First one is from Linda. Does it make sense for someone to quarantine for 14 days if they have no symptoms but may be asymptomatic? The second question, I've recently completed a 10-day quarantine after testing positive. Is it safe for me to go to family gatherings or fitness classes without fear of getting infected or infecting someone else?
So it's okay. I'll start with the sort of second half about
Sure.
someone who was known to have been positive. So in the 8 or 9 months that we've been doing this, we have learned a lot more about how long most people remain contagious once they've had a COVID infection. And the good news is that for most people who have normally functioning immune systems and did not have a very severe infection, by the 10th day of illness, you're no longer contagious and you're not a risk to anyone else. So we know that the tests that we do sometimes can stay positive for a long time, but that does not mean that you are contagious. So once you're 10 days out from your infection, you are not likely to transmit the infection to other people. So that is a safe time to go. There's some point at which we think there's a risk that you could be reinfected. The jury is still out on that. But when you go to see family, even though we know that you are not a risk, it is important to be a good role model and wear your mask and follow the other safety measures that the rest of the group is to help encourage them to all stay safe as a community.
Another question from a viewer. If we both quarantine for 14 days and have negative tests before, can we go to see our family for the holidays?
So Allison covered the isolation part of the last question, which is about how long you should stay home when you are sick. But I'm going to tackle both the last quarantine and this together. So quarantining after a high risk is really sort of like an individualized stay-at-home order. It's a way of saying you have been exposed to the virus, and so if you stay away from other people, even if you get sick, since there's nothing we can do to prevent it at this point, then you won't be able to pass it on because you'll be on your own away from other people. So that's the purpose of quarantine, and the current duration of quarantine after an exposure is requested to be 14 days. And so that usually means that at the end of 14 days, we know that you are not likely to have gotten COVID, and even if you did get asymptomatic COVID, you'd be over it for the most part. So that 14 days is an important time period. Now, these individuals who want to hang out together, families that want to get together despite all of the risks involved in the situation, the recommendation is to quarantine for 14 days and be tested somewhere in there near the end. And if you quarantine for 14 days and are negative, you can even quarantine for less. So if you are going to get together with other families, please convince everyone to quarantine starting now, because even 5 or 6 days makes a difference, but 14 days is the gold standard. And then you get together after you have a negative test, likelihood everything is going to be just fine, as long as you don't pick anything up on the way to the meeting or the gathering.
One thing I do want to remind our viewers, because some of the questions we're getting are very similar to the questions that we may have asked earlier in the program. This program will live on Facebook. It'll be on YouTube and our website, so you can go back and watch it again. If you missed something, you can catch the first part of the show. Chelsea has a question. How safe is it to take a walk outside? Should you wear a mask? What about getting fresh air in a neighborhood setting, as what she's talking about? She says, not a busy path.
Outside is great. Anything outside is fantastic. And, you know, from a mask standpoint, if you are walking alone and are not likely to encounter anyone, it's perfectly safe to walk around outside without a mask. my stance is that when I go out for a walk, even if I'm not expecting to run into anyone, I do wear a mask, less because I'm worried about protecting myself and more because I want to demonstrate that I believe it's an important thing that we should be doing. I never leave the house without a mask, and I almost always have it on.
Another question from a viewer. Some places are offering blood tests, some nose swabs. Are there differences? Is one better than the other?
Well, there are a lot of differences. It's kind of the Wild West right now in terms of COVID testing. Blood tests often are looking for antibodies, which will only tell you if you had infection before. They're not usually positive when you have acute infection. Then there are the nasal swabs, oral swabs, saliva tests, all kinds of swabs. And these can come in a lot of different varieties. I'm going to talk about two different kinds. There's PCR tests, which look actually for the genetic material of the virus. They often take a little longer to come back. We do have some tests that we could do in the hospital that'll come back in an hour or so, but the majority of them take a couple of days. And that test will be positive for a long time after you've had COVID because it's extremely sensitive. It's very, very good at identifying if you have COVID or not when you have symptoms. And we even can use them in asymptomatic people or people that don't have symptoms to screen over time to see whether or not they have COVID. The place where you collect the swab from, or if you collect saliva, does matter. Nasal swabs and nasopharyngeal swabs are much more likely to pick up the disease than just an oral swab or a saliva test on average, but saliva tests and oropharyngeal swabs, depending on the platform that is being run, can be acceptable alternatives. Then there's the rapid tests. And I don't think that's the great name for them because, like I said, some of the PCR tests can come back pretty quickly. But these rapid tests look for just a marker of the virus's outer coating, an antigen. And those tests are not always positive. They're only positive really when you have the most amount of virus circulating. So you can be negative with any of these tests. You can be negative one day and positive the next. But you can have symptoms and still have a negative test with those rapid tests. And so oftentimes, if you've got symptoms and you get a rapid test, you're frequently advised to also get a backup test with another nasal swab that can come back in a few days, that sort of thing. And so you kind of have to be a little bit careful, but all of the places that we know about are following the guidelines for getting these tests. And so, that's why you have different steps in different places, different kinds of tests, different turnaround times. It's because we've sort of cobbled together a testing program. And I know many of you are having trouble accessing any testing because there just isn't enough to meet the demand with all of the people that need testing.
Yeah, it's tough right now, but I think you've great advice. Paula asks, I tested positive on the 11th and have a follow-up next Monday. If I test negative, can I fly on Tuesday?
I've lost track of days of the week. 10 days from the initial test, and as long as your symptoms are resolved, or you're fever-free for a day, is generally when we clear you. So it's actually less about having a negative test and more about the time from when your symptoms started.
Great.
So it seems to me that that's okay if my math is correct.
Yeah, I think you're really on the edge, but and I might not do the repeat. I don't think you need the repeat test if you're better. I agree with Dr. Bartlett.
Interesting. Okay. What kind of advice can you offer to people who are living with someone currently who has COVID?
The best way to avoid getting COVID from somebody who lives in, it's hard to avoid getting COVID from someone who lives in your house, but it's not impossible, right? So that is, the best way is to put them alone in their own room, their own space where they can sleep and be and rest up. They should have their own bathroom if they can, but that's not the end of the world. If they can't, you'll just need to clean that bathroom frequently and make sure everybody washes their hands. Bathrooms have better ventilation than the rest of your house, so you can feel good about that. You also don't want to share, this should go without saying, don't share towels, utensils, try not to sleep in the same place as the person with COVID. And anytime you as the caregiver go into the room in order to provide food or take things away, you want to be really careful. That means wearing both a mask and protecting your eyes, and also asking the COVID positive person to put on a mask while you're in the room. Don't stay too long. That room is full of COVID droplets. And the less time you're in there, the less likely it is you'll pick them up. So drop the stuff off, pick the stuff up, and then take it back and wash it right away. You don't want to leave it sitting around for other people to have contact with, and make sure you wash your hands every single time. Keep the room clean as best you can and open windows and doors. That's the best advice that we can give.
Dr. Bartlett, here's a viewer question for you. What are your thoughts on in-person schooling?
So I have 3 homeschooling or remote learners upstairs who are trying to contain themselves during lunch, more or less effectively. And they are in the 3rd through 5th grade, which is sort of a gray area. There's no good answer to in-person schooling. There's public health implications of having kids in school because there is a risk of COVID. And there are severe public health implications of having kids not in school and not learning and not developing their social emotional skills and not eating. And all the other important things that school provides. And so in-person learning has been demonstrated that it can be done safely. It's not inexpensive. It requires the kids to wear masks and the teachers to wear masks and class sizes to be smaller and cleaning to be more frequent. So it is hard work, but it absolutely can be done.
I haven't heard a peep from many of your remote learning kids, so you're doing a great job, apparently.
Yeah, mine's making a blow dart thing on the other screen.
I heard some screaming upstairs, so I don't know.
So if your screen goes black, we'll know what's going on here in a moment. We'll just have to.
I'm hoping there's not real darts in that, and just like or something.
I'm hoping the exact same thing. Dr. Landon, can you talk about social bubbles, because that's something we've heard a little bit about recently, and again, it's that we try to keep our social bubble small. Can you tell us what you mean by that?
Yeah, so anytime you have unmasked contact with another person, including the people that you live with, they become part of your bubble. So that's what we consider a bubble. And that means if you go to a restaurant where you're eating indoors, all those other people that are in the restaurant that were eating there with you are part of your bubble now. And the way to stop COVID from spreading is to keep your bubble really small. Because if your bubble is 10 people and each person in your bubble has a 10-person bubble, that can get really big really quickly. And that's how this disease spreads, because it spreads before we realize that we even have symptoms, and it can spread without anybody having symptoms. So the smaller your bubble is, the more disease that there is in the community, the more tight your bubble needs to be. Right now, people should not be having unmasked contact with anyone outside of their household families, their household contacts. And if you live all alone, obviously, I think it's fine if you have a significant other that is, doesn't necessarily live with you. That's a very reasonable person to have in your bubble. If you don't have a giant family, and if your kids need one other person, that would be okay. Over the summer, we had said 3 to 5 people, 3 to 5 contacts per person would be okay. But now we really need to tighten that down. This is all about math. So all of the disease spread of COVID happens because one person has contact with another person. And if one of those people has COVID and the other one's susceptible, there can be a transmission. And the way to stop that is not to ignore it and not to pretend like we don't have COVID, but to put barriers in place so that people can get together without having the COVID spread. And that means masks, that means distance. So that means it's not going to be easy to eat together with these other people, but it doesn't mean you can't have friends. It just means that you have to have masked encounters and do things with them that you can do masked, or where you can have more ventilation, or you need to be outdoors, which I know is hard in the winter. But there are ways to not have COVID spread, but still have social contact. We just need to do them.
Have time for one final question from a viewer, and this is from Paula. And she wants to know about antibodies. What are they saying about antibodies in people who have survived COVID-19?
I think every day the science changes a little bit on that. I think this week we saw something about the fact that it looks like antibodies may last a long time and protect you, and then the following day, just kidding, it looks like they're not going to protect you for very long. And so I really think the jury is still out. Reinfection can happen, but it still seems rather infrequent. And whether that is because it won't happen or because it takes longer than a few months is really uncertain. And so I think, again, as with everything, until we have better information about this, we need to assume the worst, assume that antibodies don't protect you after an infection, and you need to continue to keep yourself and your contacts safe.
We are out of time. I didn't see a blow dart ever, so that's good. We survived that. You guys were fantastic as always. You share a lot of really, really good information, and it's important information for our audience. So thanks for taking time. I know you're very busy, and we appreciate you doing this. And thanks to our viewers, because again, great questions, and it's all all important information. Please remember to check out our Facebook page for our schedule of programs that are coming up in the future. Also, if you want more information about UChicago Medicine, take a look at our website at UChicagoMedicine.org. You'll find all kinds of information on COVID there, how to protect yourself and your loved ones. If you need an appointment, give us a call at 888-824-0200. And remember, you can also schedule your video visits by going to the website. Thanks again for being with us today, and I hope everybody has a great weekend and a safe holiday.